Welcome to Distance is No Obstacle, a medical education podcast aimed at providing bite-sized education and information for people working in rural and remote Australia.
Welcome to this episode of the Distance is No Obstacle podcast. This episode is adjusting to general practice after hospital life. I am Daniel Mogg, a new GP fellow and the Medical Education and Training Advisor for GPRA, or General Practice Registrars Australia, and I'm your host today. Rural Health West and GPRA have joined forces today for this episode to explore the transition from those pre-vocational hospital years to working in the community in general practice. Now, I did my hospital years in Canberra in the ACT and down on the beautiful south coast of New South Wales, before then moving back into GP training in Canberra. Joining me today is Dr Rebecca McCracken, a GP registrar in Western Australia, who has just moved to Broome to complete her GP training. Now, Reb did her medical degree in WA and spent a number of years working in various hospitals before starting GP training in 2022. She is just about to complete her fellowship with the ROC GP. But also keeps herself very busy with her young family, hosting a community radio show, and as a film photographer. So, Reb, thanks so much for being here today.
Thank you very much for having me.
Now, maybe if we could start just by you telling us a little bit more about your journey since completing medical school.
Yeah, definitely. It's quite nice. I've reached this full circle moment, I think, in about to be starting my finishing term in GP up here in Broome, because it sort of all started for me up in Broome about 10 years ago, in my penultimate year of medical school, doing rural clinical school here, which is where I initially kind of fell in love with rural general practice. I fell in love with this idea of being part of a community and this sort of flexible work that I saw my mentors and educators were able to do. And I also kind of fell in love with their lives in a way that I hadn't sort of seen in the hospital before. And so that was in, as I said, my kind of penultimate year. And then somewhere along the way, I just forgot. I just forgot that was what I wanted to do. Maybe the more cynical part of me, I got stamped out of me in the hospital system. And so I did internship, and I ended up moving to Darwin after that. I did some residency years there and came back to Perth and just felt quite lost and unsure about what I wanted to do. I kept working in the hospital system, and I mainly sort of focused in the critical care areas. I thought that was perhaps what I wanted to do, but it never gave me a real sense of fulfillment. And I ended up, after quite a number of years in the hospital, just feeling quite stuck and really not knowing what I wanted to do, where I wanted to be. Was medicine in at all for me? And then some little part of my brain was like, hey, remember that year in Broome? Remember, you did love that. I was like, oh no, I don't think I want to be a GP. But I thought, no, it felt, I'm trying not to be too dramatic about it, but it felt almost like this kind of last ditch attempt of like, just apply and just see. And then, so I applied to the ADPT program and thought, if you're going to do it in the way that you initially loved it. So I applied and went to Denmark, which for those not in WA is about kind of 450 k's south of Western Australia, beautiful, small coastal town. I thought, really throw yourself into it. And I started, and there was a big sense of relief, because I thought, yes, oh no, this is what I want to be doing. I'm finding I'm getting work satisfaction again. And I sort of haven't looked back really since then. And now I'm finally, the full circle point of about to kind of doing my last 6 months of training here in Broome, and then finally, I guess, becoming what I 10 years ago thought that I wanted to do. So yeah, it's nice.
Fantastic. What a really interesting journey. It certainly does sound a little bit like a homecoming in multiple ways, coming home to general practice,
Yeah.
to rural healthcare as well. So really fascinating. Can you remember what it felt like when you first started working in general practice after being in the hospital system for a number of years?
Yeah. Yes and no, probably. I think there is that, of course, that transition, which I think comes at any point on your kind of medical journey where you suddenly take on a different role and there's this large, steep learning curve. And I think for me, what I was quite thankful for was that I had worked as a registrar previously. And I think that was helpful in terms of just having had to make decisions. Because people talk about decision fatigue in ED, but I think there's a lot of decision fatigue as well in GP practice of that, every single consult you're thinking, what am I going to investigate? What's my plan? What am I going to say? And it's a lot of consults in a day and a lot of decision making. And so which can be scary and overwhelming as a first term registrar when you haven't thought about these things in such a long time. And also that it can be so, often when you start a new hospital term, it can be quite contained in a way in that you can make sure you brush up on your endocrine before your endocrine term, or you can brush up on your cardiovascular stuff. And whereas this is sort of, it's hard to know where to start. So that was a big challenge. But it does come back to you. And I think it's okay not to know is a good thing to have in your head. And also to constantly have therapeutic guidelines up on the screen. It's just like the most helpful thing, I think.
Absolutely. It's one of those top sort of bookmarks on your
Start the day, open ETG, open MIMS, open AMH, have it all there.
That's tip number one.
Yeah, exactly.
That's so interesting. I certainly remember that feeling of being both excited and really nervous about moving into general practice. I was super excited to be sort of going into what I wanted to do, sort of leaving the hospital system and everything that goes with that. But really nervous. It's like this unknown, it's like getting out to the frontiers, this sort of unknown territory. How was the work different in general practice compared to the hospital?
Yeah, I think the first thing that strikes you is that you're by yourself. You're by yourself in a room, and that's so different and something that you, I guess, unless if you've done a bit of clinics in the hospital, but even in clinics, they're a lot more dynamic, I think, probably than it is in your GP practice and you in your room. And so that is a big change, and I think that's took a little adjusting and a little while of getting used to as well. And the work is also, as we sort of touched on, it's so varied compared to the hospital work, in that you might go from a really sort of intense mental health consult to freezing off someone's ward and that kind of jump is quite different as well in terms of getting your brain used to that. I think, even in, say, for example, my background, I'll probably talk a bit about ED just because I had done quite a lot of ED, but like even in ED, which is very varied, it's often, not the worst day of someone's life, but they're there for a kind of reason that they think is very significant, whereas GP is not like that. And so I think there's a lot of like shift in the flow of the day, which is quite different. The other thing that I found kind of different and a little bit of a challenge is that there's not always a very clear referral pathway in the same way that there is in the hospital. This person has this problem, we're going to refer to this specialist. Who? Doesn't matter. You're just referring to that kind of, in-hospital system. Whereas in GP, that took a bit of, referrals make up a reasonable amount of what we do. And so actually learning not just which specialty, but whom, and within, particularly, I think in both metro and GP, metro and rural, in terms of that specialist really likes this thing and this specialist really prefers this, and this psychologist is really good at this particular form of therapy. And when you're first starting, that's all. The easy answer is just refer to psychology, but who is a next step, and that's something that you need to learn.
Yeah, you really need to kind of learn the local area, the local landscape.
Exactly. Yeah.
Yeah, which is great. One of the great things about general practice, but also, like you say, it's one of the steep learning curves when you're first in an area and trying to work out who's good at what, who likes to see what.
Exactly. Yeah.
It's definitely, I mean, I certainly felt like the tempo in general practice was different, and not to say that it was a lot busier or a lot quieter than the hospital. You had a bit of time in ED, and certainly that can get extremely busy and hectic. But in general practice, the tempo, this real sense of appointments, to work through that workload in as much of a timely way as you can, was a bit of a shift.
Yeah,
a bit of an adjustment. So, I mean, sorry, you were going to say something.
Oh, no, I was just going to say you're exactly right, because I think in general practice, in ED, even though you're trying to do things as quick as you can, things can take as long as they need to, almost in a way that I don't think you quite have that. Some things have to take as long as they need to in GP, and that's just the way that it is. But you kind of don't have that luxury the same way you do in ED. Which is tricky.
Absolutely. No, you're spot on. That's so true. The other thing that I sometimes think back on is when I was in the hospital system, a lot of people would say to me, "Oh, general practice is so boring. It's all coughs and colds." And I remember being a little bit worried, thinking, "Oh, am I going to be really bored in general practice?" And actually, the variety really surprised me. Obviously, there's absolutely days when it is a lot of coughs and colds, but sometimes the stuff that comes in, like you say, there's lots of pivoting back and forth between things, and it really keeps it quite interesting. But it is, again, it's a bit of an adjustment.
And sometimes you're almost relieved for that cough and cold to come in, because you're like, oh, great, I just need this to be able to take a breath, tell you don't need antibiotics, explain this to you really well, and that's like a nice, easy consult, and I can kind of catch my breath and get the rest of my day. Like, I completely agree. I also thought, like, tears and smears is the other one, and it's not at all. Yeah, it's really not.
It's a lot more. Do you have any tips on how to survive that kind of change, that steep learning curve when someone first enters general practice?
Yeah, I think it's tough, and there's no way to not ascend that hill. Like it is going to be challenging, and it's going to be sort of overwhelming to begin with. And I think always sort of going back to basics is really helpful. And the most sort of basic thing, I think, is communication. And I think it's really important to really start from early on. You're communicating well with your patients. I think a lot of GP is we talk about sort of sitting with uncertainty, and I think a lot of it is trying to manage patients' expectations, and that might be the expectation that they can come in with 6 different things and that you can manage them all in 15 minutes, or it might be their expectation that you're going to do an investigation that you're not going to do, or whatever it is, or the expectation might just be that you know a lot about this thing that they've come in with, and it just might not be an area that you do. So I think it's important to communicate well with them and find out what their expectation is, and be able to address it in whatever way that you can. And I think it's okay to say, look, this isn't something I'm really comfortable with, or this isn't something I'm familiar with. And patients actually like it when you say what it is that you do know and what you don't know. And I think it's okay it's okay not to know, and it's okay to involve your supervisor as much as you kind of see fit and need to in those early times. I think don't get caught in thinking that you should know everything and you're going to go home and look it all up later. I think involve your supervisor as much as you need to in those early days to really kind of get your comfort. So yeah, communicate with patients really well, focus on that. Use your supervisor. I think we'll probably talk about supervisors a little bit more because that's such an important part of becoming a GP registrar. It's a really useful tool, so use your supervisor. And I think just try to be aware of those referral pathways and try to kind of take it on when people might mention it just in passing. Oh, that surgeon's really great at that. Or, oh, they only visit X times a year. Try and sort of take that on board. That's quite important as well, to sort of know your referral pathways. I think my other sort of tip is just to do with that feeling solo in the room, is that this kind of goes with talking to your supervisor, is that you're not as solo as you think you are. Try to remember that, even though it can feel like these four walls are around you and you might not feel stuck in a situation, you can call your supervisor. There's other senior GPs at the practice that you can call and talk to. And you can also pick up the phone and call the hospital. That's always, I'm such a big advocate of calling specialists. And I think they're so much often friendlier to you than they might have been when you were the ex-resident in the hospital. So remember that you've got specialists that you can call in, because you don't need to know everything.
Yeah. It's such a hard mental shift, isn't it? I know when you go through medical school or as a junior doctor, often what you're trying to do is show that you do know stuff. Spend so much time trying to be really convincing that you know stuff, that it's a really hard shift to then flip it and kind of be comfortable saying, oh, actually, that's a great question. I don't know that, or I haven't quite seen one of those before. But what's really impressive is those people in really senior positions, and you can kind of see that the more senior people become, often the more comfortable they become with uncertainty, with not knowing. And like you say, as long as you kind of know who to go to or where to look. Yeah. But it is a change, that's for sure. One of the things I guess that I love about general practice, and this was also a lesson that took time, was really that you do have time as a tool, and that helps kind of manage what feels like a very busy 15-minute consultation. Or it also helps when you don't know, is that often, not always, like you said earlier, not always, but often you've got the time to say to someone, I'm going to need to look into this more. I'm going to need to speak to someone about this. Let's see how this evolves. It's a bit nuanced, but it's a great tool that you often don't have in a hospital.
Yeah, I think you're exactly right, and I love that as well. And I think that's, we get nervous about these 15 minutes appointments, and we think that we should, especially when you start, you sort of think, I've got to do all of these things in this 15 minutes. How am I going to manage it all? And actually, early on, one of my supervisors said to me, like, don't. You've got time, and you should use that time, and you should focus on one specific thing. And if you do need to manage the patient's expectations and say, look, there's these other things that I want to address with you, but today we've really just got time for this. That's actually really important, because there's not enough time in that 15 minutes, but you have time. You're their GP for life. You're developing a longitudinal relationship with them. And so you can, as you said, you can watch how things evolve. And I also loved that, picking up the phone and being able to talk to patients. It's that I used to hate in ED, sending patients home and then thinking a few days later, oh, I wonder if I hope they're okay about that. But you never know, and you'll never be able to talk to them again. Whereas I love, having the opportunity to call in a few days and say, oh, just checking, has that gotten a lot better? Did that cream work? it's really, yeah, it's that you can use time, as you said, to manage things really well.
And patients love it. They love a phone call when you check in on them.
Yeah.
I guess one of the other big shifts when a registrar moves into general practice is around the working conditions. So it's not just sort of the clinical stuff, but it's also kind of the environment that you're working in and the employment and training and all this kind of stuff. And it is a bit different in general practice compared to hospitals. Can you tell us a little bit about how it's a bit different?
Yeah. So first off, especially I can sort of wax lyrical as someone returning to GP from maternity leave now, and what I think is incredible, and that really I don't think you can get in any other sort of hospital subspecialty, is actually the flexibility of the way that you work, which is pretty amazing. So the ability to full-time, part-time, and part-time is not necessarily just you're working these specific 2 days. Like, you can be more flexible. Kind of caveating all of that is that, and working arrangements in general, is that they change and it's different practice to practice. So this is something I think, if you haven't already sort of decided what practice that you're going to work on, it's a bit different to in the hospital, where you get a job, you kind of sort of maybe perhaps skim read the contract. Yeah, I know that the working conditions will be great for them to sign that. I think, you need to have a discussion with the practice that you're in. You need to find out what and how you're going to be paid. Some positions will be salaried, some positions will be based on billings, and also finding out what arrangements can be made if you do want to work part-time. Can you sort of work odd hours? Can you do just afternoons, just mornings? Sort of finding that out from the practice, and also find out what your leave entitlements are. There is a set minimum, but it's worth discussing with the practice, negotiating with them, and finding out what those entitlements will be. It will be less, pretty much across the board. There'll be a few instances where some practices have really excellent arrangements, but across the board, it is going to be less than what you might have been used to in the hospital. And so that is something to be aware of. On the flip side of that, you're not actually dealing with nameless, faceless HR department. So you actually generally can get your leave. Someone who knows you as a human being in front of them, you're discussing with them about your leave. So that is a really nice benefit. It was quite a change, I found, working in general practice and being like, I think I want to take these days off and leave here. And it's like, okay, yeah. Oh, great. I get to choose. So that's nice. But yeah, do be aware that it is different.
Yeah, it's like you say, you're essentially moving from what's usually a big organisation, often, like a government department in ways. It's big, funky. Yes, it's got great policies and protocols and procedures, but it's not very agile or nimble. And you're moving to what's often a small or medium-sized business. And so they might not have all the big HR department behind them, for better or worse. And so it is a bit different. Like you say, there's definitely some differences around entitlements for GP registrars, and this traditionally has been a big turn-off for some people considering general practice as a specialty. I know certainly there's a lot of activity happening now to try and balance that out. Absolutely. And so I don't know if some of our listeners who might be following that, earlier this year, the government announced some big initiatives to try and balance the playing field, including things like some financial incentives, quite generous financial incentives for brand new GP registrars, and also study leave entitlements and parental leave entitlements, which in the past have been something that general practice has not been able to provide so much. So things are changing, which is good. But like you say, it's obviously still different to the hospital, and it's good for registrars to check these things out before signing any contracts. Now, you mentioned earlier, you talked about supervisors and that kind of relationship. And obviously, it's one of the really key relationships that you'll have as a GP registrar or as a pre-vocational doctor during a GP rotation. It can really kind of make or break the experience. How did you kind of get the most out of that relationship to make it a good experience?
Yeah, I think it's such an important relationship, and I think going into it, it's really important as the registrar to take ownership and to take responsibility of the relationship and what you sort of need to get out of it. I think it's worth being honest with yourself and your supervisor sort of early on about where your areas of weakness are, and kind of talking about that. And also try to sort of remember that in any profession, as you've been doing it for a while, you forget things that are difficult for someone first starting out. And so it's okay to ask those questions. How do I use this? How do I actually do a referral to a public hospital? Like, how does this template work on the computer? These are things that your supervisor might not think to go through with you, but you don't need to sit there in frustration in your room trying to figure this stuff out. But in terms of being organised, I think it's really important. It's difficult for a busy GP to kind of have the time to think about what you might need to learn. So I think you need to take that responsibility on yourself as a registrar and make sure that you're organising that time. Make sure that it's split on both of your schedules. Make sure that it's that you've discussed with them what you're going to be talking about beforehand. I don't think it's particularly fair to spring a topic on them first thing in the morning on a Friday to be like, hey, can we just, can you tell me the ins and outs of this? I think for you to get the most out of it, you want them to have had an opportunity to sort of think about things before meeting with you. I think also getting the most out of the relationship is being aware of the whole thing of sort of medicine is a science and an art, and think about not just what you can learn from them in terms of the science aspect. How would you investigate this? What prescription would you give for this? But think about it also as the art. They've been doing this for a lot longer than you have, and they might not think to tell you these tips and tricks and the way that they might approach a consultation or the way that they might discuss things with a patient is actually really important to learn as well. And some of it is with the art of it. You will take on some things and you will think, yes, that's how I want to do my practice, and some things you won't, and that's okay. But there's still definitely things to learn. The other thing is, I think probably medicine is a science and art and a lot of paperwork, and so and I find that paperwork in GP it's tricky and it's hard to learn how to do it. So I think also learn from them with regards to, what resources do they give a patient? What's their go-to handout for tennis elbow? What's their go-to symptom checker that they find? Like, use them for things you might not think of and that are consuming and time-consuming to learn for yourself. You can use your supervisor for that as well. But overall, I think it's really important for you to be organised and take responsibility of what you want to kind of get out of it.
It really sort of highlights just how much, I guess, medicine in general, but probably really particularly general practice, it's still that kind of apprenticeship model where you're really working closely with the kind of senior experienced doctor, and you're trying to observe and learn and absorb as much and hang on to the things that fit right with you and that are good practice, and maybe not hang on to the things that don't kind of sit right with you or that you might, not disagree with. But it's definitely that sort of apprenticeship kind of model, isn't it?
Yeah, exactly. And I think something I've learnt just throughout career and as time goes on is that there's many ways to skin a cat. And that's really, just as you said, you might have done it different, but it doesn't make something right or wrong. There's just different approaches, and it's sort of learning and testing out what your approach is really important to sort of learn and develop.
So if you had to boil it all down to, I guess, a simple piece of advice, what advice would you give to a registrar who's just starting out in general practice or doing a pre-vocational placement in general practice? What piece of advice would you give to them?
Okay, I've got two. One is boiling it down, and one is a bit boring and not very sexy, but I think is worthwhile thinking of. And I think it's a bit yucky, or I found it a bit yucky to begin with, starting out GP and thinking about billings, and thinking about money when you just want to be practicing, best practice medicine. But I think learn billings. Learn it early, learn it well, understand it, because it's important for you, but it actually improves your practice, and I think it improves, and maybe necessarily outcomes, but it improves, can't think of the right word, but it improves things for your patients as well. You're practicing better when you understand billings. So not very sexy, but take the time to understand that, get that out of the way. Then I think my other piece of advice when starting out is just try to be as reflective as you can. Try to, GP can be really difficult. It can be really overwhelming, and try to, if you can, take the time to think about which were the consults that really had you really overwhelmed, which were the consults that woke you up in the night thinking about, what were the cases which you wish you had discussed with your supervisor and you hadn't, and I think take on that reflective practice and discuss it with your supervisor, discuss it with other colleagues, discuss it with senior colleagues, with other registrars. And I think that really helps in that transition phase. And I think you'll find when you discuss with other colleagues is that tricky consults are just tricky, and they're tricky. They are tricky for everyone, and that often it'll feel like there was no obvious answer, and that's probably because there was no obvious answer. And so I think just trying to be reflective and discuss your cases rather than kind of holding yourself up and not discussing the cases that you found really challenging. I think that's my main piece of advice.
Two excellent pieces of advice, so thank you for that. Now you've arrived in Broome. What excites you about a rural move?
You maybe can see the sun streaming out the window, so that's one part of it, or streaming in the window, I should say. No, I just really love. You sort of said in your intro, I've been involved in community radio stations, and I love communities in general. I love being a part of something sort of a bit bigger than yourself, but close and small and intimate. And so I'm really excited to be working here in Broome, to start working here in Broome and sort of immerse myself in the community. I'm excited for the work flexibility. I think I sort of didn't have a chance to touch on this, but there's so much, aside from flexibility in just work hours, I think there's so much flexibility in GP, in the type of work that we can do. And I think in rural areas, that's particularly true. I'm personally going to be sort of working towards a rural generalist specialty, and so just having that ability to have the flexibility to do some work in the hospital, because I do miss working in a team and I miss people, but also I love GP work and I love working with patients so intimately. So I think those opportunities just exist in a rural community. So I'm excited to be here.
Fantastic. That's so good. Now, before we finish up this episode, is there anything further that you want to add?
Oh, I had one other thought, I think, while I was thinking about this and thinking about the transition and thinking about GP in general. I think one other thing I did think was, I think it's worthwhile thinking about and having an area of special interest. I think that across your day, it can be so nebulous, and you can have 30 consults that you might have done perfectly fine, adequate, probably a very good job, but you might have felt very unsure about all of them, or just felt like you weren't quite up to speed on exactly everything. And I think when you have an area of special interest, or something that maybe you've done a bit more training in, or you've just in your own time that's what you focused on, or you've did a lot of this in the hospital beforehand, just having within that day, having 5 or 6 consults where you know that you've nailed it, that it comes really comfortably to you, that you know that you're completely up to speed with best practice. I found that very comforting and really helpful to kind of deal with the times. Then it makes it a little bit, it almost feels a bit exciting at times when you don't know, you have to look that up, or I just need to look this up and I'll call you later, but let's do these tests first. That those were a little bit more exciting, rather than the whole day feeling like you're just a little bit unsure. And then the other great thing about having an area of special interest is that you can, later down the line, you can work a few days in GP, and you could work in a sexual health clinic or a travel clinic, or in a small ED, or it just gives you more flexibility that I think can give you that break from GP, which sometimes is needed as well.
Yeah, absolutely. That's a great piece of advice, and definitely having that thing that kind of nourishes you or sustains you. And also, it just kind of really shows that how versatile general practice is. It can still take you in so many different directions.
Totally.
Which is a great thing about it. So now, for anyone seeking more information on becoming a GP, whether that is the early transition out of the hospital like we've talked about today, or in their final hurdles and facing their exams, GPRA actually has a range of resources to help with any questions that you might have, whether it's about employment and training or education and exam prep. We've got advice, support from our registrar advisors, webinars, study partner matching, books, practice exam questions, and clinical cases as well. Now, the best place to find out more is on our website at gpra.org.au, or you can obviously follow us on all the usual socials, including Facebook, Instagram, or LinkedIn. Now, thank you so much, Reb, for generously sharing your time with us today, and all the best with the move and life as a GP as well.
Thank you. Thanks so much. Thank you for having me.
And thank you also to our audience for listening to this episode of Distance is No Obstacle. If you found today's discussion helpful, be sure to check out our other episodes covering a range of rural health topics. You can find them on the Rural Health West website, or by searching Distance is No Obstacle wherever you listen to podcasts like Spotify or Apple Podcasts. To stay up to date with new releases, follow the Rural Health West on Facebook, Instagram, or LinkedIn. And that way you will never miss an episode. So thanks for listening and for all the vital work that you all do in rural healthcare.